Hello, and welcome to Coffee with the Commission with the Washington Medical Commission. Today we'll be discussing the changes to the initial application procedures and the impacts of COVID-19 to our licensing process. Joining us today, we have our subject matter experts, Marissa Courtney, licensing manager, and Emma Marienthal, licensing specialist. Marissa and Emma are going to give a short overview of the changes in licensing, and then we'll use the rest of our time to answer questions. Please remember to keep your microphone muted if you are not speaking. So with that said, I will turn it over to Marissa and Emma.
All right. Hi, Jimmy. Thank you so much for having us. I don't think at the beginning of 2020 anyone saw all of these changes coming. I think everything that licensing has done previously, I don't think there's anything that hasn't changed this year. So I think with Marissa and I, this is the perfect opportunity to just have some time to discuss what's been going on, the changes that have happened over the summer, and then what is coming down the pipeline. So a lot of exciting things are going to be happening for licensing here in the next couple months and down the road. As far as changes and streamlining things for licensing, we've seen a lot of waivers, extensions with the state, most prominently with our renewals. The Secretary of Health extended all health professionals' renewals from April 1st, expiring through September, to the end of September, September 30th. So that's been great for allowing people to focus on patient care and patient safety and not really have to worry about the hassle of paying for a renewal or going through that process right now when they have much more pertinent matters to attend to. We've seen that have great an outcome for our providers so far, so that's been a great program. The other thing that has helped us get through this COVID-19 response are fingerprinting. We have been able to waive so far due to just the fact that a lot of facilities are closed and providers aren't able to get those completed. So we don't want to hold anyone up on our end. We want to make sure that we are licensing providers as quickly and efficiently as possible. So we've been able to waive that fingerprinting requirement. Also, at the beginning of this summer, the commission was together and voted on ways to shorten and streamline our application, and we've seen a lot of great outcome from that. We wanted to make sure that the application was more friendly and efficient to process. Some notable changes are that we're no longer needing license verifications, we're no longer needing hospital privilege verifications, and shortening the chronology requirements. So not only are we making things easier on our end, we're trying to make this as quick and easy for the providers and applicants as possible. So hopefully, not pending any more changes, which a lot of these are unforeseen, but we're hopefully going to be seeing these changes with the application start to come out towards the end of the year. And hopefully the applicants will be able to access everything quicker and easier, and we'll get people to work faster in Washington. So we're very excited. Everything is coming together in a way we didn't think was going to come together, and we're just excited to make licensing prominent and professional and proud, and make sure that we can provide the best process for anyone wanting to work in Washington as possible. And so Marissa, our licensing manager, is going to be talking about how licensing is going to be updating the processes in the next couple months and how we are changing things for the better.
Thank you, Emma.
Thank you.
As Emma stated, we have a lot of changes, and with this pandemic that's happening across the world, it has also highlighted things that we as the licensing unit was not prepared for. With that, in March, we were sent home for at the directive of our governor. And with that, we were not paperless, and we saw the need after being in this new uncertainty and we decided that as of beginning of September, we were going to implement a paperless process. With this implementation, this allows us to be able to effectively work on applications no matter what situation happens in the world, whether it's a natural disaster, another pandemic, or anything that happens. We want to be able to make sure that our applicants are our number one focus and that we're able to provide them with the best quality of customer service and efficient processing for their applications so they can do their jobs and provide the best care to our patient or their patients. So our commitment to our stakeholders and our providers is that we are doing everything that we can to make sure that no matter what happens, life or things in the world, that we are still operating in a successful manner. With COVID, we don't know when things will go back to normal, but we are just going to go forward in this new process. And I think that we are confident, actually, that this is going to help expedite our licensing timeframe and just be able to be more efficient and provide better customer service now that we'll have access to everything in one portal instead of having documents come in through mail or things like that. The licensing unit just wants to thank everyone for their cooperation during this time of uncertainty and change. We definitely noticed that there was some things that could be improved for the better, and that's why we made these changes. So we just want to thank you for your cooperation and feedback, and if you have any questions, please feel free to email us at medical.commission@wmc.wa.gov or give us a call at 360-236-2750. Thank you.
Thank you so much, ladies.
Thank you.
Thank you, Jimmy.